Welcome to Dr. Bernstein's Diabetes University. This is Dr. Richard Bernstein. Today we're going to talk about a complication of diabetes called Berg's atherosclerosis. It's spelled Monkkebergs, Berg's. And I believe there's an umlaut over the O. Now this is one of the most common complications of diabetes. Yet, most doctors don't know about it. They are taught in medical school about a condition called medial calcification, and they're never taught about what causes it. Now, there was a recent article in one of the medical journals that found several explanations for why this happens, and I'll give you my old explanation and tell you a little about the condition. When I was a kid, 12 years old, whenever I saw my doctor, he did very little in the way of physical exam, even though he specialized in diabetes, but he would take a machine called an oscillometer and measure something in my legs. I'm going to show you an oscillometer in a second, and I'll explain it to you. This is the oscillometer. When I hold down this little lever, you can see the needle starting to swing, and it gives a little swing with each heartbeat. When I let go of the lever, it stops swinging. When I push it down, it starts to swing. The other half of the system is a blood pressure cuff, which is I'm unwrapping from my leg. I'll show it to you. Here is the blood pressure cuff. Here's the bulb I use to pump it up. Now, the principle of oscillometry is now used in many of the automatic blood pressure machines that are on the market, and many devices that are sold as apps for cell phones for measuring blood pressure in your fingers and so on and so forth. But what I look at on this device is not blood pressure, which it can measure, but rather the distance that the needle swings. And that distance that the needle swings measures two things simultaneously, and it's not necessarily easy to distinguish them. One is, are the major arteries in the leg constricted or impaired? Is the flow impaired? In which case you'll get a very low swing. The needle may only swing a quarter of a unit. A unit is the number of lines that you saw on the dial. Each line is one oscillometric unit. So if someone has severe impairment of blood flow, the needle might only move a half a unit or a quarter of a unit. On the other hand, most diabetics, especially after the first few years with diabetes, have wild swings. They might swing by 15 or 30 of these units because the muscle in the wall of the arteries has become calcified. Now, how does that happen? The explanation that I gave in an article that was published in 2001 goes something like this. the muscular wall of the arteries in the legs is supplied by sympathetic nervous impulses to close down whenever you stand up, so that blood doesn't pool in your legs and deprive your brain. So you would pass out if the blood pooled in your legs. So that's a self-protective measure that is part of human evolution. When you stand up, your arteries in your legs close down. Now, in diabetics, something else happens. The arteries get calcified. Not the lumen or hole, not this, the hole is the lumen. The muscular wall, here's the muscular wall that goes around. This is the lumen on the inside. So we see in diabetics the muscular wall becoming calcified. Now, if the sympathetic nerves that activate that muscular wall die because of diabetic neuropathy, the muscles are no longer innervated. And as you know from polio, when muscles lose their innervation, the muscles die. Now in polio, when the muscles die, they disappear, and the leg gets the appearance of a stick because all the muscle around the bone has gone. But in Munkeberg's atherosclerosis, for reasons that are not clear to me but were recently explained in one of the journal articles, the muscle turns to calcium. It turns to stone. The muscles become calcified. And when you try to compress the artery with a blood pressure cuff, you get what's called a bounding pulse, and the needle swings a great distance due to this calcification. And this calcification, also called medial calcification, is also called Munkeberg's atherosclerosis. Why is it called medial? Because the arterial wall has three components. It has an intima, the inside lining. It has a tunica externa, which is an outer lining. And then in the middle is the muscle, which is also called the tunica media, and that's what calcifies. So it's medial calcification. Now, when I was in medical school, I had been diabetic, I don't know, let's say 30 years. No, it must have been more than that. I was, let's say, 48 years old, minus 12, I was diabetic 36 years. And I decided to apply for the Joslin Foundation's 25-year medal. And to pass the 25-year medal test, you have to show no Munkeberg's atherosclerosis. So they asked me to send an X-ray of my ankle and lower leg. And I had this done at one of the hospitals that I was rotating through as a medical student. And what we saw on the X-ray, the radiologist called trolley tracks, parallel lines, which is what the view of a calcified artery would look like. The calcium is thicker when you look through the sides of the artery than it will be in the middle of the image. So we saw these trolley tracks going up my legs, and we sent them to the people at the Joslin Clinic, and the vascular people said, "You fail. You have Munkeberg's atherosclerosis." And he was correct. Now, the people who qualify for the 25-year medal are extremely rare because almost no diabetics get away without getting Munkeberg's. And that's the reason I'm talking about it, because it's so utterly common, universal. And when I do this test on a brand new patient, I might get normal readings, and frequently do. But once they've had diabetes for over 5 years, when they first come to see me, they clearly have these big wild swings. Now, if I see a patient at the time of diagnosis, get his blood sugars normal, and test him 5 years later, we don't see Munkeberg's. We see a normal set of readings on the oscillometer. Now, one little bit of information. My chief, the guy who ran the clinic where I worked for 30 years or so, was the world's authority on the diabetic foot and on vascular disease in diabetics. And he taught me that this condition was incurable. Well, he measured the oscillometry on me when we first met, which was in 1983, I think. And I had a reading of 18 in the calf, and it was 12 in the ankle. Normal is 4 to 11 in the calf, and half that in the ankle. So it would be 2 to 5.5 in the ankle. So I was grossly abnormal. I really was loaded with calcium in my arteries. About 5 years ago, I was lecturing the residents in my clinic, and we had run out of patients. It was always easy to demonstrate Munkeberg's atherosclerosis with the oscillometer in diabetics, because they all had it. And all the people who ended up in our clinic were long-term diabetics. So I said, well, we have no patients. I'll be the victim, and I'll let one of you guys measure the oscillometry on me. And I showed them how to do it. And we got readings on me, and I was 12 and 6. No, I'm sorry. I was 12 and... I got it wrong again. I was 8 in the calf and 4 in the ankle. And that's sort of like in the middle of the normal range. Not only that, the ratio of the calf to the ankle should be 2 to 1. If you have Munkeberg's, there's a lower ratio. So here, some 30 years after I had originally been tested, the Munkeberg's had gone away. Well, I was the only victim probably in the world who had experienced this reversal of Munkeberg's. I wasn't even going to attempt to publish it because, number one, in medicine you usually don't publish just one case. They do it in psychiatry, but usually not in the medical journals. So people want verification from additional cases. And secondly, the author was Richard K. Bernstein, who finds it very hard to get published in the official American diabetes journals, because he's been considered an opponent of the standard treatment of diabetes. So here, after 30-odd years, we reversed my Munkeberg's atherosclerosis. Why did it reverse? Well, we do know that neuropathies reverse when blood sugars are normalized. We know that the longer the nerves, the longer it takes to reverse the neuropathy. Now, I could speculate on what happened with me. I had normal blood sugars for 35 years or whatever it was. It was actually since 1973, 72. And so for these many years, I had normal blood sugars, probably regrew the sympathetic nerves. There may have been a little bit of smooth muscle left in the arteries in my legs. And for all these years, the sympathetic nerves are now stimulating this little bit of muscle, and apparently the muscle must have regrown under the influence of new nervous stimulation. What happened to the calcium? I don't know. But new muscle, smooth muscle, came about thanks to normal blood sugars. And I can assure you that there's nothing else that could reverse this other than normal blood sugars, unless they develop some new hormones or something that cause nerves to regrow. So you keep blood sugars normal, you could prevent Munkeberg's, and I've prevented Munkeberg's in many of my patients. It's harder to reverse it, but that certainly is possible. In any event, this is a virtually universal condition. Any doctor can test for it if he has an oscillometer. There's a problem, though. In the USA, you can no longer buy oscillometers, where many years ago, every doctor would have one in his office. They're not even available because doctors are no longer taught hands-on care in medical school. So there are one or two oscillometers, electronic oscillometers available. I believe they're made in New Mexico, that are used for research studies, and they're quite costly, so that doctors, number one, don't even know they exist, but they also wouldn't want to spend the money for them. So that's the story. It's a very interesting condition. There's still one problem that's out there in the medical industry, and that is how to distinguish coronary artery calcification from Munkeberg's atherosclerosis. When you take when you do a calcium score of the coronary arteries, where you take a picture that displays the amount of calcium in the walls of the coronary arteries, how do you know that you're not looking at Munkeberg's atherosclerosis rather than calcium deposits in the interior, in the lumen of the artery? So deposits that adversely affect the flow of blood. I don't know how that can be done. I've asked radiologists how it can be done, and they can't answer it for me. We used to think that Munkeberg's atherosclerosis had no adverse effects, but we now know that it does. And in my article, which is referenced in this video, as an addendum, I point out a recent study that occurred just after I submitted the article, that the smooth muscle cells in the blood vessels, in the arteries, produce a substance that stabilizes plaque in the coronary arteries. So if you lose your smooth muscle cells, if they become calcified, they're not going to produce the stabilizer, and plaque that protrudes into the lumen of the artery is more likely to break loose, move upstream in the coronary arteries, and block something and cause a heart attack. Now, that plaque that can break loose is called soft plaque. It can be imaged by a CT angiogram, but once you have Munkeberg's atherosclerosis, that soft plaque is more likely to break off. So the radiologists find that to predict heart attacks, it's a good idea to get both the coronary artery calcium score, which might or might not be mostly Munkeberg's atherosclerosis, plus the CT angiogram, 2 tests. And these 2 tests are frequently performed in conjunction at radiology centers probably around the world. They're now a pair of tests that jointly predict future heart attacks. It's an interesting subject. Take a look at my paper, and we'll talk to you at the next session of Dr. Bernstein's Diabetes University. Before you sign off from this session of Diabetes University, take a look at my book, Diabetes Solution, which you can view at the site listed below, or you can purchase from any online bookstore. Also, visit my monthly seminars, teleseminars. The site for getting these free seminars is listed below. You can also join the Diabetes Forum, where you can ask questions to other diabetics who have read my book and have been using it. And one last thing is, if you go to the teleseminar, you can ask questions which I will answer, if not the same month that you ask the question, within a month or two thereof. Thanks.